Hi, I'm Dr. Timothy Thomason, and this is my video tutorial covering drops for allergies, also known as sublingual immunotherapy. When people with allergies breathe in pollen, dust, and mold, it sets up a chain reaction in their immune system. First, a particle of pollen binds to an antibody called IgE, which is sitting on the surface of a mast cell. The mast cell then degranulates, which means it releases compounds such as histamine, which in turn leads to a process called IgE-mediated inflammation. And it is that inflammation that leads to the symptoms that are familiar for allergies, such as congestion, sneezing, runny nose, itching, coughing, or wheezing, conditions that affect millions of people around the world. First, we try to avoid things that we're allergic to, such as using a dust-proof mattress cover and pillow cover, and washing bed sheets twice a week in hot water. Also, washing your hands after you've been handling pets or other things that you might be allergic to. Next, we try allergy medications, such as antihistamines, nasal steroid sprays, nasal saline. And if that doesn't work, then we should consider immunotherapy. Immunotherapy desensitizes patients by giving regular small doses of the offending allergens so that the immune system becomes less allergic. The most common way that this is performed is with allergy shots, also known as subcutaneous immunotherapy. Allergy shots really do work great, but they require weekly visits. And, of course, they're not for everybody because they're uncomfortable. And there are also possible allergic reactions, which requires patients to come to the office to receive the shots. Allergy drops, also known as sublingual immunotherapy, is an alternative to shots, and there's no needles and there's no weekly visits. So let's think of an example of our patient here, John Doe, who happens to be allergic to grass and to oak trees and to cedar pollen and ragweed. Now in Texas, that's a problem because he's going to be allergic to the outdoors for about 10 months out of the year. So with sublingual immunotherapy, we take extracts of the different types of pollen that he's allergic to, and we precisely measure it out and put it in a treatment bottle. We then take that treatment bottle and we dilute it down several times until we have a very weak concentration. Then we start treatment. The first 3 weeks are with the first bottle, then the second, the third, and the fourth. And by the end of 3 months, all of those allergy symptoms such as congestion, sneezing, runny nose, itching, coughing, wheezing, and the need for allergy medications all gradually go away, which of course makes our patient very happy. And we'll continue that treatment on a maintenance dose for about 2 years. By the way, this is a great treatment for kids. Kids don't like needles, and they do love the drops, which of course don't taste bad. So, of those millions of people, why doesn't everybody do this? I think the main reason that I've noticed is that nobody has told them about it. Or in some cases, cost may be a consideration. There's a lot of offices that charge hundreds of dollars per month, and this treatment is usually not covered by insurance. However, in our office, we're a little easier on the wallet. We charge $105 for a 3-month supply. And by the way, you probably won't be needing the allergy medications, which cost about that much anyway. The bottom line is we want our patients to be happy, and this has been a great treatment for us now for many years. Give us a call, and we'll be happy to set up an appointment, or you can go to our website, dfwallergyrelief.com, and request an appointment online.